Okay, I'm here to perform the medication procedure. When I come in, I will check the doctor's order against the medication administration to make sure that it's correct. I will double check it, make sure it's correct. If everything is good, then I will go to the cabinet where the medications are. I will be pulling it one after the other. Proteinase, I'm giving him proteinase, 40 milligram. Make sure I have it, and the same milligram. I will get, the next one is Lesis, 20 milligram. Make sure I have Lesis, 20 milligram. The next one is Lesnopre. Make sure I have Lesnopre, 10 milligram. Correct. I make sure I have Correct, 12.5 milligram. The next is eardrop. I make sure I have the correct dose. Then after getting all my medications, then I will double check it before taking it to the patient. I will check and make sure it's the right drug, right dose, right time, right route. And also make sure that it's still within the range, it's not expired. I make sure I have the right patient as well. I will look up here to see if the patient is allergic to any of these medications. When I correspond that it's not, then I will put the whole medications in the cup. And walk to the bedside of the patient and make sure I have everything I need. Yeah. When I go to the patient's room, I put it on the table on the bedside, introduce myself to the patient. Hi, Mr. William, Miss William. My name is Valentine. I'm a VSU student nurse. I'll be your nurse today. How are you doing today? The patient responds. Then I will ask the patient her name, the date of birth, to make sure it's accurate information on what I have. After she told me her name is Miss Williams Johnson, her date of birth is 03/28/1976. I also check her armband to make sure it's the right information. After checking it, I will as well check the band whether the allergy the prescribed here is the same allergy they put on her handband. Then after that, I will do my hand hygiene. After I do my hand hygiene, put on gloves. Then I will check her vital sign to make sure it's within the normal range. Then if everything is okay, then I will ask the patient to sit up for me. Then before giving her the medication, I will get a sip of water, hand it to her for her to drink so that I can assess her gag reflex and make sure she'll be able to swallow. Then I get a cup of water, a little water, give it to her. She drink it, no problem, no choking. Then I will know she's ready to take the medication. After that, I will get the medication, double cross it again, check her name again, is the right patient, check all of them, right time, right drug, right route, right dose, and make sure it's not expired. Check the expiration date. Then I'll be checking it through each one I go to. Check proteinase, 40 milligram. I'll pour it. Then I'll check light Lesis, 20 milligram by mouth, time 9 o'clock. Right drug, right dose, right patient, right route. I'll pour it. I'll do the Lesnopre, 10 milligram. by marks, right route, right dose, right mark, right patient. Then after checking all of them, after checking it again, then I will explain the patient the purpose of the medication, what the medication works for, because as a nurse I'm supposed to know what it works for, so that I don't give the patient the medication that is contraindicated to her or she's allergic to. So after that, I will explain one of the medication is LASIS. LASIS is a loop diuretic medication. It's used to treat edema, renal failure, heart problem. Then I will explain to the patient that one of the side effects of the medication is headache, dizziness, blood vision. That why she takes the medication, when she wants to get up, she has to get up slowly so that she don't have to fall on the floor. Then I put the whole medication in the cup and hand it over to the patient with the water. She take it. Then after taking it, then I will explain to her that I'll be giving her otic medication. Before giving the otic medication, I first of all warm it. After warming it, before I give it to her, I will check her ear canals to make sure it's not there. If it's there, I will get a rag or tissue to clean the outer canal of it. Then after that, I will have the patient to lie by her right side, so that I will administer instead to lie at her left side, so that I will administer the right side here. Then I will stay it by, I'll get the bed down, and that way she doesn't have to injure her neck.